Hello. Welcome to Emmi. Now, you're here to learn about COPD, which stands for Chronic Obstructive Pulmonary Disease, and this also includes emphysema and chronic bronchitis. Now let me tell you about medications and treatments for COPD. After all, knowing how to use your medications and talking to your doctor if they're not helping is something only you can do. First of all, anytime you go see your doctor, put all of your medications in a bag and bring them with you. And I'm not just talking about your COPD medications. Bring everything, including heart, blood pressure, or allergy medications, even things like vitamins, eye drops, herbal supplements, or any sort of over-the-counter medications, like aspirin. This will help your doctor make sure you're not taking any drugs that work against each other. All right, when it comes to medication, the main thing to keep in mind is no matter what medications you take, following your doctor's instructions can help you feel better. Here's the thing. Many people with COPD don't realize they're used to just feeling bad all the time. So even if you feel okay, taking your daily medication as directed can help keep your airways under control. It can mean fewer infections, fewer flare-ups, and there's a good chance you may feel better day to day. So if you have any questions about how or when to take your medication, ask your doctor or check with your pharmacist. One type of COPD medication helps the muscles around your airways relax so you can breathe easier. You may hear these called bronchodilators. They're usually taken by breathing them in through an inhaler like this one. You may have heard of drugs like Atrovent, Combivent, Ceravent, Foradil, Spiriva, Zopanex, or Albuterol, also called ProAir, Preventil, or Ventolin. Which one you take depends on your COPD and how severe it is. So just make sure you understand how and when to take any daily medication and when to take other medication for a flare-up. And let your doctor know if your medication isn't helping. He needs to know. Okay, sometimes inhaled steroids are also used to help reduce the swelling and inflammation in your airways. This can help open up your airways, so it's easier to breathe. So your doctor may put you on an inhaled steroid if your COPD has flared up a lot in the past. Now, I know you may hear the word steroid and you say, aren't those dangerous? But inhaled steroids are not the same as the steroids athletes sometimes use. Different thing. And sometimes inhaled steroids and bronchodilators are combined into one drug, like Advair, Symbicort, or Dulera. This way you can take both medicines at the same time. I'll tell you more about using an inhaler in a minute. Now, if you have severe COPD, you may be on oxygen. And oxygen can be life-saving. It can help you move and do things with less shortness of breath. And it can help protect your heart. Using oxygen may not make you feel better right away, but keep using it, and over time it will help. Also, even though we all sort of think of oxygen as air, it's important to understand that oxygen is medicine. So if you're on oxygen, follow your doctor's instructions. He'll probably tell you to adjust the flow based on whether you're active, resting, or sleeping. Only use the flow he prescribes for each situation. Do not use a higher flow. This could actually harm you. If you have any problems, let your doctor know, but do not make changes on your own. I know it's easy to think, it's oxygen. How can more be bad? But like any kind of medication or drug, too much can cause real problems. And if you smoke, never smoke while using oxygen. This can quickly cause a serious fire, and oxygen tanks can actually explode. So if you're going to smoke, take your oxygen off. Make sure the valve on the tank is closed, and move away from the tank before lighting up. I hope you found this information useful. Thanks for watching. I wish you the best of health.